Um,
So welcome everyone. We are doing our third webinar and we are going to have hopefully some really good discussion, some presentations from Mohan and from Ben and from Zoe. We will introduce them later on in the webinar. And we're also going to have a really great film by William Hay at the end, so that'll be something exciting to look forward to. Yeah, so we're excited to listen to these people talk to us. If you've got any questions or anything that you want to sort of discuss or to ask these people, please put them in the question and answer box, and we will endeavour to try and get through to them. And if you're watching on the YouTube link, you can put them on the live chat and that will be monitored and get the questions through as well. So over to Dr. Mohan.
Excellent. Good evening, everyone, and welcome to our third webinar. I want to say a big thank you to all the volunteers out there. It's volunteer week this week, and without all the volunteers out there, we've not been able to do half the amount of work we've done. So a big thank you to all of you. So as Alex was saying, I'm gonna start off by talking a bit about primary care and GP practice, how things have changed during COVID. And then I'm going to hand over to Ben to talk about how the community has responded and what services exist out there. So I'll switch over to the slide. Is that on the big screen now? Yeah. All right. So this is the first slide. I mean, the map on the furthest left is a map of Merton, and it shows the different clusters of GP practice in Merton. And so the future is that practice will work closely together. So you can see by the dots, there are 6 different coloured dots there: green, blue, orange, light blue, red, and purple. So that's how practices have come together to work together, to support each other and have new ways of working. So we've had hot clinics, hot visiting clinics, and these hot clinics are meant to support patients who we think may have COVID and need further assessment. And so they've been able to go to specific sites where the clinicians have worn PPE to make this happen. So that's just an example of how the new ways of working and how we've responded to the COVID response. I'm going to go to the caption the furthest on the right. So that says the coronavirus, stay home, protect the NHS. So that was the initial campaign at the beginning, and it was during lockdown, stay at home and try and support the NHS. And now we're sort of starting to exit lockdown. What does that mean? We still need to be careful. We still need to social distance, and we need to still ensure that we stay alert and prevent the infection from coming back, certainly to the levels we had previously. And that's what the middle slide is about. It's about the NHS is open for business, and actually people do still have medical problems which need further attention. So if you do have any ailments or any conditions which need support, please do contact your GP or 111, and they'll be able to signpost you or support you the best they can. All right, so how has primary care transformed? So I talked a bit of the first one here, the 22 practices. So there's 6 networks in Merton, and they've all been working very closely together to try and support the healthcare needs in Merton. We've now moved to a telephone triage consultation type model. And so any calls which have come in, a patient will be contacted back by the GP or healthcare professional to talk about what the issue is and where it can best be addressed. A lot of patients have been not keen coming to the GP surgery, and the GPs are not keen on going out and visiting at home because of spread of the illness. And so that's why we've moved to this telephone triage consulting model. We've also done a lot of remote working, giving advice on the phone, video consulting, and making sure that we have the appropriate PPE to prevent any cross-infection. We are continuing to do essential services, so blood tests for patients who need them for certain medical conditions or certain drugs which they may be on, and it's important that still has gone ahead. and that is starting to reopen now for more routine blood tests. Moving on, we also have our hot clinics, which are in Merton, as I said earlier. Patients who we've spoken to on the phone who we felt have needed further assessment and we're worried about COVID, we've asked them to come to these hot clinics, and they're currently based at 2 practices in Merton, one at Wimbledon Medical Practice and one at the Nelson. And they'll be accessed by the GP practice, who will say, look, I think you need further assessment, we'll book you into one of these slots. And this will minimise infection from patients to doctors and vice versa as well. Children's immunisations are important. So we've continued to provide those for children who've needed them. And so that's important that we don't get behind on that. So that still is occurring. I forgot the prescriptions sent electronically. So to prevent patients coming in, we're able to send all our prescriptions electronically, which is great. We're now starting to look at whether we can give medical certificates and also whether we can do blood forms electronically as well. So I think that would be a big change once we get that in place. And then finally, the last thing I want to talk about is the volunteer support. So the Merton Mutual Aid have been fantastic in terms of mobilising themselves around practices, and we've been able to get some of the volunteers to support GP practice by dropping off medical equipment at a patient's house, leaving it on the doorstep, and walking away, and the patient then using this device to then help give the numbers or give the levels to the doctor, who can then give some advice on the phone. So that's been a great support, and that process has allowed the patient not to be in close contact with the volunteer, and the volunteer not to be in close contact with the patient. So I'm really pleased that that's got up and going, and I look forward to growing that in months and years to come. I want to bring you to this slide here, which I think really shows what phase we're going to be entering now. And so it's quite a busy slide, but this is what happens in a pandemic. And so if I look at the first graph, so it's the pink one, or the first curve, this is the immediate mortality, and this is the immediate impact of COVID on people's health. And so we had quite a lot of number of deaths. We peaked around the middle of April, and we're starting to come down with this acute phase, and we're hoping it will stay down and there won't be a second wave. But this is the first thing we see in a pandemic. The second thing we see is this green wave, which is the patients who have not been to see their GP, and they've not been to see go to A&E, and these are sort of slightly urgent conditions which patients have delayed, and now we're encouraging patients to see their GP. Now we're starting to get quite a lot of backlog of patients coming through, so that's what this second wave is. And then the third wave is this blue line here, which looks at some of the long-term conditions which patients have, and how that's been interrupted. So things like routine care, routine blood tests, routine reviews, these have been halted temporarily while we've been dealing with these first two waves, and so that will come in the next few weeks, few months as well. Now I want to alert you to this big red wave here, which is the fourth wave, and this is the writings come off there, but it's actually the mental health or psychological conditions. And so patients who have been isolating at home have been finding it very difficult for their health and well-being, because we're social animals and we need to be outdoors, and so you need to get some activity outside, get some fresh air, otherwise you'll start feeling isolated and you'll start not being able to feel as well as you should do. So that's a really big key area, that one, because we've had patients who are having mental health problems before COVID happened, and COVID has enhanced that and made it a lot worse. And so it's an important key type of cohort of patients we need to take into consideration. And so what are we seeing now in general practice? So in the GP surgery, so we'll have a list of patients to contact on the phone, and we're getting a lot of patients contacts from shielded patients. So these are the patients who have certain medical conditions, and they've had to stay isolated in their house for up to 12 weeks, which will come to the end of June. And these are for patients who are extremely vulnerable and have been advised to stay at home. Otherwise, there's a high risk that if they get COVID, that they may not have a favourable outcome, and also they may end up having to go to hospital. So, a lot of queries about, what does that mean? Are they allowed to go outside? What can be done to help with their health and well-being? And so, we've been deploying the social prescribers to help support them, and Ben, who's going to be talking in a bit, will help advise, what exists out there and how that can happen. We've also got the mental health and alcohol use and misuse. That's also been quite prevalent of late, as well as patients are starting to turn towards having a bit extra to drink. And the last time we had this webinar, we had WDP talk about this and signs to look out for. Social isolation, again, people have been isolating as per guidance, and that has had big implications. So Ben, I'm going to let you talk about social prescribing a bit later on. Domestic violence, which Zoe Gallen will hopefully be joining us later to talk about. She's here, which is great, so I'll let her talk about that. But there has been an increased incidence in domestic violence and safeguarding as a result of COVID. We've increased the uptake of public and healthcare professionals, both to see whether individuals have got the infection, and now there's a big drive to see whether there's been a past infection to COVID, and that's a blood test, and that's starting to become more widespread. So watch your space in that, and that will tell us, that will identify how widespread the pandemic was. We're looking at the most vulnerable in our society, so care homes, and there's a big piece of work being done across Merton to try and support those patients who are in care homes, and certainly to ensure that infection is kept to a minimum. And we've got the Merton Community Response Hub, which I'm going to pass over to Ben now to take over and explain what that is. Please do, if you do have any questions, put it in the chat box, and we'll come to those at the end. So is that me done? Oh no, so I'll just talk about my recovery phase, and then I'll pass you to Ben. So the recovery phase, what we are sort of entering now, we call it the recovery phase, although we're still not out of the woods. But what's happening now is that we're starting to bring back cervical smears. We're starting to look at long-term conditions. Mental health services are starting to reopen to what was around before COVID occurred, and the NHS is still out there. So if you do need support, contact 111 or your GP. Maternity services are still around, so please do attend those. And we have outpatient appointments are starting to open up as well. So a lot of outpatient appointments were kept on hold or postponed for later on in the year, while the hospitals were redeploying a lot of their staff to help on the front line. But that's starting to reduce now. So that's the recovery phase we're in at the moment. So Ben, I'm going to pass it over to you. Are you able to take over from the Community Response Hub?
Yes, please. That's fine. Thank you, Mohan. Hello, everyone. Can you see me? Yep, that's fine. Thank you. Good evening, everyone. My name is Ben. I'm the Social Prescribing Manager at the Merton Voluntary Service Council. And I just wanted to give you some information about the Community Hub in Merton, how we have started, and what's the offer out there for local residents. So the first slide is just to tell you about who organized the Merton COVID-19 Community Response Hub. So it was Merton Voluntary Council, Merton HUK, Wimbledon Guild, Common Side Community Development Trust, and also Friends in St. Helier Hospital. Of course, this initially we started to have this community hub at Vestry Hall in Merton, but then of course the lockdown happened, so mostly we were operating remotely. All of this was done with the support of the London Borough of Merton, and for us was a great opportunity because we really worked closely together with the voluntary sector, with the NHS and the local authority. The next slide would be to tell you what sort of services are available for you since we started. And this is only possible, like Mohan mentioned before, because we had hundreds and hundreds of volunteers came forward to help us. So the services that we are able to offer at the moment is to help vulnerable or shielded patients with shopping or food parcels, dog walking, electricity, gas meter top-ups, telephone calls to keep in touch with them, posting letters. And then there's another service. This is what our team provides, the social prescribing team. We have helped 186 residents so far since the 8th of April to receive prescription and medication in Merton. So if somebody will run out of medication or prescription and they're unable to leave the house, they could call the community hub, they make a referral to us, and we have several options. It could be either a local pharmacy that could deliver the medication, or we can then make another referral to an NHS volunteer. So that service is up and running for 7 days a week, and been really helpful for some people who are unable to do this. There was a lot of flexibility around volunteers, different voluntary groups, as I mentioned, local authority, NHS. Even though it was a difficult crisis, it was really good to see the creativity and the flexibility of everybody involved to support the most vulnerable people in Merton. The next slide, I just wanted to show you some numbers in terms of what has been achieved so far in terms of different services from the community hub in different numbers. So in total, 129 residents called the community hub for themselves because they needed help and support. Also, we had 594 family members or friends who are concerned about the local residents. So this is possible as well. If you are worried about somebody living in Merton, you could call the community hub if you're unable to attend or to visit. Then we can make sure to check in with them. Yes, altogether was 414 calls in total. As I mentioned, 186 people received medication and prescription. We had 687 offers from volunteers. Over £18,000 were donated to the Merton Giving Fund. And then we have delivered 479 food parcels. And again, this was only possible because people donated and companies like big supermarket companies donated food, and we were able to deliver those food parcels. This is just to show you that that community hub was created in a very short period of time, and we're still learning as we go. We were very, very busy the first few weeks. It has gotten a little bit slower recently because we think we quite managed well to support most people. So the numbers, they have dropped a little bit in comparison to before, but it's still very much needed. As Mohan mentioned before, there are about 6,000 shielded patients in Merton. And at the end of June, they should be at home until the end of June. And obviously, it's not just about their medical history and the risk in relation to COVID. It's also their mental health and well-being. So our team, the social prescribers, we have a team of 9 social prescribers. We are based on 22 GP practices. And this is something that we really put an emphasis on and a focus, the shielded patients group, and as well as patients within care homes. So yes, I mean, a lot of work has been done. The offer is still there for you. If you need anything, or if you know about somebody who needs support, please don't hesitate to contact. And as mentioned before, there's still a lot of work to do with our partners from the NHS and from the local authority. That's about it from my part. If you have any questions, please drop them.
Excellent. Thank you, Ben. Yeah, please do. If you've got any questions for anything this evening, then please do put it in the chat box. We have got Zoe Gallen here, but we can't see her. But can we hear her? Zoe.
Yeah. Hi, yeah, can you hear me?
Yeah, we can hear you.
Apologies, it's the council security on the laptop. It doesn't allow you to use your video on Zoom at the moment. It works on Teams and it works on Skype, just not Zoom.
Okay, Are you right to carry on with that? You don't want to try it on your phone, or are you okay to just, can you see the screen and stuff?
Yeah, so I can see the screen. I can see all the lovely faces around, so that's fine.
Excellent. All right. Well, do you want to start off by introducing who you are, and then yeah, we'll crack on.
Yeah. So I'm Zoe Gallen. I'm the Domestic Violence Coordinator for Merton, and my role sits within the Community Safety Team at the Council, and I have a couple of responsibilities. One of them is ensuring that we've got domestic violence services in the borough, doing lots of comms on Twitter and social media. And the other job I have is to manage the high-risk case panel for domestic violence. I've got this kind of slide up just so that you can see what the definition is of domestic violence, and that's what I work to on a daily basis. So most of our work is around domestic abuse, which is the psychological, financial and emotional abuse that victims will experience. We do have domestic violence in its sense, but it's mainly the coercive control over finances, and some of the kind of gaslighting that goes on. Within Merton, we've got a number of services for victims, and one of them is our community IDVA service, and an IDVA is an independent domestic violence advisor, and their role is to contact every single victim they get a referral for and start offering support to them. The other service we've got is our refuge, and that is a safe space for women. Obviously for safety reasons, I can't say where it is in the borough, but it's in the borough. The other service that we've got on borough is something called complex needs, and it's an IDVA with the specialism around mental health, substance misuse and alcohol. So we can access all of those services, and so, you know, residents can as well as professionals. Everything goes into our IDVA service, our community service, and then what they will do is they will kind of like triage and see what the client needs, refer them to a service that they might need, but also hang on to them for long-term support and advice. And their aim is to kind of reduce the risk to that victim. I say victim because even though we have many, many female victims, we do have a lot of male victims in Merton. And the split is about 70% women, 30% men. So I always state victim survivor rather than he, she, just because we do look after male victims. Our complex needs service and our community IDVAs will both look after men. Obviously for our refuge it's female only, and there is a male refuge within the UK, but it's always busy and there's always a waiting list. In terms of COVID and how it's affecting our services, there's been a national increase to the National Domestic Violence Helpline, but within Merton we haven't seen the spike that the national services have. And I think that's purely because the national services have been in the media a lot more. We've seen some increases, but it's not unmanageable at the moment. I think our thought is that when lockdown is finally lifted fully, that's probably when we will see a lot of our victims coming to talk to us. We've got a one-stop shop on a Monday morning at Mohan Baptist Church, and at the moment that is closed to face-to-face work. But it can be accessed via our community IDVA service. So I think once that's up and running, which we're probably thinking is going to be the end of July, beginning of August, I think we're going to see many people coming into us and you know, disclosing what they've been through over the lockdown. Some of our IDVAs have been really, really clever in the way they've spoken to some of our victims over lockdown. It could be, you know, a 10-minute slot that they've got with them while they're walking to the shop. We had one victim that she's working from home, and she had agreement from her line manager that she could use her work email as a way of contacting the IDVA. So for the perpetrator, her partner, he thought she was just working normal day-to-day work, but actually she was contacting our IDVA service via her work email, And she actually said it was probably the most free she'd felt in a long time, because she knew that her partner wouldn't be looking at her work laptop. So she felt quite free to kind of have conversations with the IDVAs. Our IDVAs are doing a lot of code words at the moment. So they may call the victim and someone else picks up. So they would say a certain phrase, or they would say they are telesales people. If it's not the victim they're talking to, and they would kind of apologise and hang up. So they're being quite imaginative at the moment. I think what we are seeing an increase in is a lot of victims coming from the Merton Uplift service and the recovery support team service within the mental health teams. And I think that's because they are still seeing patients face to face. So people are disclosing what's going on, and then those professionals are referring into our services. In terms of our high risk case panel, we are seeing a slight increase, and that's mainly from police referrals, because the police are going out to the call outs. They are risk assessing and they're deeming the case as high risk. So it's coming into our case panel. So they're busy, and they're every 3 weeks. And it's where we sit with a group of professionals, and we all kind of take the responsibility to reduce the risk of harm for that victim. But they're getting slightly busier. But like I say, our general community work is kind of steady at the moment. And I don't know if you've got pen or paper or how you want to do it, but there's a telephone number for our community IDVAs, and anyone can ring them Monday to Friday, 9 to 5, and it is 0207 801 1777. It's on, if you go on to Twitter, if you've got access to Twitter, I'm on Twitter as Zoe Gallen. I'm always tweeting numbers and support services and things like that. So more than happy if you want to follow me on there, and I can share information. The 0207 801 1777 is not a service. That's open, like I say, Monday to Friday. The national helpline number, if you've got a pen handy, is 0808 200 0247. And that's the national number. Ah, Doctor, you've put it up on there. Thank you. And that makes it so much easier. So they're the two numbers. So we would always say, you know, you can go to the national helpline and they will support you. And what they will do is, if you want local services, they will refer you down to local services. You can ring that local number during the week and ask to talk to someone and let them know that you're from Merton. We're also, there's a campaign running at the moment called Listening from Home, and it's asking neighbours to listen out for their neighbours, and if they hear something that they're not too sure about, or they're worried, they're asking, the police are asking that you dial 999 and report it, so that you can kind of help your neighbour when they're in trouble and if they can't get to the phone. And we know that Listening from Home campaign works because we run it a few years ago, and I actually had a case, quite a horrible case to be honest, and if it hadn't have been for her neighbour calling the police, she probably wouldn't be with us today. And it was because the neighbour heard what was going on, rang the police. The police used what they call their big red key to get in the front door, and literally managed to intervene just in time. So we would say that if you are a neighbour and you hear your neighbours, please, please, please call the police. Or if you know someone that just wants some support around their domestic abuse, you know, they can call those numbers. I'm more than happy to help assist and be the in-between if that helps some people. Obviously you can't see my face, but you've heard my voice and you can hear it's a friendly voice. So if there is anyone that, you know, even if it's just to drop me an email and say, I'm a bit worried about my neighbour across the road, how do I report that? And you're a bit worried about calling the 999, I'm more than happy to help with that. Crime Stoppers are also running a domestic violence campaign, so you can always ring them anonymously, and any report they get, they are passing it down through the police chain to local police forces. So you can always report anonymously that way. So I think they're the kind of key highlights really for what's going on at the moment. I'm really hoping that our One Stop opens kind of July, August. It's been running 10 years in September, and we would like some sort of social distance party for it. And we are planning for a virtual party and a non-virtual party. So I can also let you know about that as and when it happens. And anyone is more than welcome. It will be a kind of a bit like an open day as well, so you can come and visit if we can do it face to face. If not, I will try and do some virtual video party.
Excellent, excellent. Thank you, Zoe. That's been really, really informative, and I think that's, you know, real need, and we're seeing a lot of that, certainly in general practice. I had a case today actually, and actually, you know, like you say, I think it'll be once lockdown, we start exiting lockdown, that these cases will come forward. So it's even more important now to be vigilant, and also neighbours and communities to think about, you know, what's happening in their own area.
I think communities are being really, really good in this. You know, there's been a number of emails come into our community safety team saying, I'm a bit worried about my neighbour, or I'm worried about a child, and where can I report it? And we've been advising people how to report it. We'd rather they reported it themselves than us report it as a third party, because we're just saying to the police, well, you know, Mrs. Jones told us X, Y, and Z, and actually they would like to hear it from Mrs. Jones themselves. And I know it can be a bit daunting, and some, you know, for some neighbours, they don't want to get involved because, you know, it's, you know, someone else's business, so to speak. But actually, by getting involved, it could be saving lives. And I know that from your end, Doctor, that I did a talk with the CCGs, the clinical commissioning groups, 2 weeks ago, and we're seeing a lot of clients coming through the GP surgeries because it's a safe space for them to come and disclose to. I think the other thing to bear in mind is Boots and Superdrug, mainly Boots. They have now got safe spaces within their pharmacies. And their consulting rooms have become safe spaces, so victims can walk in there and disclose and get support offered to them. And I'm in the process of contacting all the managers at the Boots pharmacies so that we can link in and help a lot more. And Superdrug have started picking it up. And I know Morrison's supermarket, if you go to Morrison's shopping, at the bottom of their receipts, they've now put the National Domestic Violence Helpline number on the bottom of it. Which I think is a huge step forward, you know, for the work we do around this.
Excellent, excellent. Thank you, Zoe. We'll come. Well, if anyone's got any questions, then please do put them down on the chat box. Alex, did you want to come in now and talk about? You've got control, haven't you, of the grapes? I'll let you take over.
Actually, can you just click forward one slide, I think. Yeah, brilliant, thank you. So yeah, we've been working as Merton Mutual Aid group. We've been really working to sort of help support this, the things that are already in place, but also to get together a network of neighbours helping neighbours. And we've been really so encouraged by the amazing support that we've had from so many people, neighbours who are just absolutely willing and wanting so much to get involved and to support their neighbours. And so we just really want to say thank you to all the neighbours that have been willing to help one another. And we want to try and continue that support on. We want to continue having this really great community feel and this sort of lovely mobilisation of neighbours helping each other. And so we're going to be, there's a survey that people can fill in, because we want to hear from you about what we can still do to support people and what people would be willing to do to support one another. So far we've done so much to try and help people during COVID-19. We've we've been working with the GP surgeries, and we've been organising collections for the NHS and for the food banks. We've doing food shopping, dog walking, you know, anything that we can. We want to be able to help people, and actually we want to see that continue to grow. So there is a form on the screen, and I will also pop it into the chat box so that it's easier to get hold of. But it would be great if people could fill in this form and kind of tell us what we can do to continue this work that we've been doing and to continue helping one another. The form is really, really short. It's only like a few questions. The kind of main questions are: have you volunteered or received support from Merton Mutual Aid? And then, have you done any of the activities, which there's a small list. So it's a really simple form, so please fill it in. But yeah, so what's next for Merton Mutual Aid, and how can we continue to support our neighbours?
Excellent, thank you, Alex. You're going to put that in the chat box so people can cut and paste. And yes, Merton Mutual Aid has been fantastic, certainly for Merton, for practices. The saturation probe I was talking about in terms of getting medical measurements to patients' houses, and you know, if we were unfortunate enough to have a second wave, then you know we've got a nice infrastructure in terms of what can help support our community because you know of what we've developed already. So I look forward to how we can build on that going forward. So please do fill in the questionnaire, or please do continue the great work which you're doing. Now it doesn't appear to be many questions, so which is fine. So I don't know if any of the panelists have got anything they want to ask. If not, we can move on to Will. Okay, Will, do you want to come in now? And this is a real treat, actually. I've had a look at it, and I've had a glimpse, and I was really nicely surprised. It's really great piece of work. So, Will, I'll let you come in and just introduce yourself and tell us what sort of drove you to do this, just so that we can give it some narrative around that.
Great. Well, yeah, I'm a videographer by trade, and during the COVID crisis, obviously I can't really commute into London to do filming. So I've been socially distanced, filming things around Merton and the volunteering people are doing, the work Dr. Mohan and the GPs are doing, and just generally documenting what's been going on in Wimbledon and around. So I've made a short 2-minute video just to summarize how I feel the lockdown has been approached by Wimbledon. So if I can share my screen, I think that means you'll need to stop. Mohan. That should be all right. So yeah, this is the 2-minute video. Can you hear that audio?
Yeah.
When you walk through a storm, hold your head up high and don't be afraid of the dark. At the end of the storm is a golden sky and the sweet silver song of a lark. Then you'll never walk
you, doctors and nurses. Thank you, teachers. Thank you, Dons, for all your help.
Thank you, Merton Mutual Aid. You're doing a phenomenal job right now.
So I'd like to thank the women community for coming together at this time of COVID and really identifying resources to support each other and each other as neighbours.
Yeah, did that come through okay?
Oh, Mohan, you're muted.
Classic error. Well, that was fantastic, and that was great to see and nice to see. What's been happening across Merton. Is there going to be a bigger version of it? Just tell us a bit more where we might be able to capture that or see the
but it's on my Will Hay Films YouTube channel, and with all the material I've done longer interviews, and I will be trying to put something a bit more in depth together in due course. So that'll be on my YouTube channel as well, Will Hay Films.
Excellent. Do you want to just put your details in the chat box, just so that in case people want to see the full version on there? There was one question which from Shuli about if you've not heard from the hospital, do I assume that I will have a face-to-face appointment? I mean, I think if you a scheduled appointment, then they're likely to have postponed it, and so you probably should contact the GP, the hospital, to find out what's happened to that, or they may be calling you at home to do a telephone or video consulting appointment. So that would be my route, is to contact the hospital directly. Any problems, then I'd contact your GP as well. Great. So look, I think if there's any more questions, please say it now. Otherwise, we'll wait for Will to put his details on there. Have you put it on there? And while we're waiting for that, I'll ask any of the panelists if they wanted to say any last words. Ben, any sort of final comments at all you want to mention?
No, I mean, after this video, there's really not much to say. It's a very nice video, and it really shows, and what Alex has mentioned before, it really just shows the goodwill and how we are all able to pull together. And I think that is the beauty of that pandemic. It shows us really that there is a lot of possibility to get closer together. And no, fantastic. So the video said it all. There's nothing left for me to say.
Brilliant. Thank you. Thank you. Zoe, have you got anything you want to say as a parting statement?
Just to say thank you really to all the volunteers. I know I've been in contact with some of them via mutual aid. I think one of the things to come out of COVID is just human kindness. And from a local authority employee, thank you.
Excellent, excellent. Alex, did you want to come in and mention? I think there was a question about will slides be shared? So maybe a bit about the link as well, and how people can see this webinar.
Yeah, so the webinar will be, well, it's been live streamed on YouTube, so it'll be up on YouTube after this as well. And we will also put a link to it on the Facebook group. We will also, for the slides, if people want to email me with their details, I can then email the slides directly across. So my email address, I put it in the chat, but it's also minister.alex@outlook.com. So minister.alex@outlook.com. And please feel free to email me and I can pass the slides on to you directly. But yeah, as a sort of word from me about just everything, I guess, thank you again for all your help in the different ways that you volunteered, and also just the different ways that you've been obeying the lockdown rules, and yeah, just keeping Merton alive, I guess, is really great. So thank you, everyone.
Thank you, Alex. And Will, did you want to say anything at the end?
No, I think I say everything I can.
Brilliant.
Beautiful.
Okay. Well, thank you all. It's been great. Really good to share what work we're doing in Merton. And look forward. Keep safe. And we'd quite like to do another one maybe in a few weeks' time, depending on what the need is. But it's been great, and look after yourself. So thank you again. And I'll draw this meeting to a close. So thank you all our speakers, and thank you all panelists, and thank you for giving up your time. Thank you all.
Thank you, everyone.
Bye bye.